Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Precautions we have to take for ASCVD. First thing is you have to take low carbohydrate diet. So what happens if you take more carbohydrate? So you know that if you take more carbohydrate, liver will synthesize more triglycerides and more cholesterol. So it also gives rise to insulin resistance. So it is metabolic syndrome in hypertension. So when you have more triglycerides and more cholesterol, you have more chances for ASCVD or atherosclerotic cardiovascular diseases. Next, coming to low saturated fats, you have to take low saturated fats. Where are the saturated fats present? Saturated fats are present in meat, they are present in ghee, butter, coconut oil. You have to take them as minimum as possible. So what happens here is if you take more saturated fat, so your VLDL production is increased. If your VLDL production is increased means, so it is indirectly increasing LDL production, and also it will decrease the production of HDL. So HDL is decreased, which are cardiac protective, will decrease, which are unsafe for heart, those will increase when you take saturated fats. It doesn't mean that you should not take saturated fat. Saturated fat is very important for human being, because with this saturated fat only, skin synthesizes vitamin D, adrenal synthesis, adrenal gland synthesis adrenaline hormone, testis synthesizes testosterone, and also ovary synthesis estrogen progesterone. If you take zero saturated fat, it is like castrating yourself. Castrating means you are cutting off your testis or removing your ovaries, and also you'll have bone density issues, and also you will not have fight or flight mechanism, or your enthusiasm, or you are pursuing for any of your goals. So adrenaline is very important. All these hormones are very important, so you have to take some amount of saturated fat. Saturated fat is present in meat, butter, ghee, and also coconut. So if you are a vegan, if you are not able to eat this, you can take coconut oil, or you can take butter, or you cannot take you can take ghee. You can avoid meat. And then comes to unsaturated fats. Unsaturated fat, first is monounsaturated fat. The best example for monounsaturated fat is olive oil or canola oil. And most of the people think that, so if you take olive oil, it will decrease the LDL cholesterol and increase the HDL cholesterol. It is not true. So it will neither decrease, it will neither increase. So it will not decrease LDL, it will not increase HDL. The effect you see here is because when you replace saturated fat, that you have to remember. So next, coming to polyunsaturated fats, there are two types of polyunsaturated fats, that is omega 6 and omega 3. It is very important. So omega 6 fatty acids are present in vegetable oils, all vegetable oils. So like sunflower oil, safflower oil. So these also don't have any effect on HDL or LDL. They will neither increase HDL or decrease LDL, so they don't have effect. The only bad effect we have for omega 6 fatty acids is they linoleic acid is a chemical name for omega 6 fatty acids. These are converted into arachidonic acid, and arachidonic acid is converted into prostaglandins. You know, these prostaglandins are pro-inflammatory. So if you have more prostaglandins, you are able to get more inflammation. The problem here is, so what is happening here is, see, we have to take omega 3 and omega 6 in the ratio of 1 is to 1. 1 is to 4 is acceptable. In our current regular diet, what is happening is it is going up to 1 is to 20. That is the problem. Omega 6 is needed, omega 3 is needed, but what is happening is that ratio is completely off balance. The acceptable ratio is 1 is to 4, but the food we are taking, or in the body we are having the ratio of 1 is to 20. That is making our body more inflammatory. So that you have to, now in the current scenario, you have to reduce vegetable fats. Vegetable fats means all sunflower, safflower, whatever the oils you are making from vegetables. Okay. Next comes omega 3. Omega 3 is very important. In omega 3 we have EPA and DHA. So EPA and DHA are very important. They will lower the LDL cholesterol and they will increase the HDL cholesterol. So these are cardiac protective. Where are these available? And also one more thing, EPA especially has antiplatelet activity. Antiplatelet activity means, So they will prevent the platelets from aggregation and having the clot in the body. Means it is mildly antiplatelet, and it is effective enough to prevent the heart attack. So EPA and DHA both together have very important role to play. And one thing we observed recently is EPA is taken separately and DHA is taken separately. This is not a good practice, because in nature you will not get EPA and DHA separately. So combining them and taking them is very important. Where are these present? So these are present in fish oil. So these are, fish is the best source for omega-3 fatty acid, that is DHA and EPA. Okay. Next, how do vegans or vegetarians get these uh, omega-3 fatty acids? They think that eating chia seeds and eating flax seeds, they will get all the omega-3 fatty acids. So yeah, omega-3 fatty acids are present in chia seeds and flax seeds, but the precursor of it, that is linoleic acid, is present. The linoleic acid is a precursor of both EPA and DHA. So that is present in chia seeds and flax seeds. Body can convert this linoleic acid into DHA and EPA, but it is very inefficient. It is not sufficient for our body. So chia seeds and flax seeds can be taken for other purposes, like they have more fiber in it. Those can be good, but uh, as a uh, as a substitute for fish oil, you cannot take it. So if you are a vegan, there is no other go for you. You have to take fish capsules. If you are not able to eat fish, there will be fish capsule available. Fish liver oil, cod liver oil, these are the best sources for EPA and DHA. So linoleic acid or omega-3 fatty acids that are coming from chia seeds and flax seeds are not sufficient for a person. So you have to eat fish oil capsules. Next thing is dietary cholesterol. So there is a myth that when you take more cholesterol by eating, it will get deposited into the heart. Normally people are afraid of eating yellow of an egg, because it contains more cholesterol. You have to remember that cholesterol is not absorbed into the body. The cholesterol which you are getting in the body is from liver synthesizing it from carbohydrate. So not from the dietary cholesterol. Dietary cholesterol is excreted through your feces. Only 8% of the people have capacity to absorb cholesterol. That is very low quantity. It is not more quantity. Only some quantity is observed. So it is effective only if they are taking heavy amounts of cholesterol, not for the normal amounts of cholesterol. So you have to keep in mind. You can take plenty of eggs. It is not a problem, and also it is very useful. Is what type of exercise you have to do for atherosclerotic cardiovascular disease. Here, the important exercise you have to do is zone 2 cardio exercise or aerobic exercise. So, how to do this exercise? So, you can walk, you can swim, or you can cycle at a pace where you can have easy conversation with your friend or the person beside you, or you can talk freely in the phone. The person in the phone can understand that you are exercising, but you will not feel difficulty. So you will not feel gasping for breath. So when you have that kind of intensity, uh, here fat is a substrate for energy, and also glucose metabolism is regulated. You will feel less hunger in that situation. So cardiovascular exercises, go for zone 2 cardiovascular exercises. Never go for zone 4, that is high intensity interval training, where you have uh, to do exercise vigorously for 1 minute and take rest. So don't go for it. When you have the suspicion of atherosclerotic cardiovascular disease, never do zone 4 cardio. And you can do zone 3 cardio, but it has to be on the advice of your doctor. But only safe exercise for you is zone 2 cardiovascular exercise. On top of it, you can do strengthening exercises, you can do power related exercises, these two, but also endurance also. You should not be touching any other endurance exercise except for zone 2 cardio. Okay. Next you have to see is stress free life. You have to be away from the stress whenever there is stress. So your glucose metabolism is hampered, so you feel like eating more fat and more carbohydrate in chronic stress. In acute stress is fine. So acute stress because of negative feedback, you will not feel hungry for 1 week. If the stress is more than 1 week, then we call it as chronic stress. In chronic stress, it is a positive feedback, and in that positive feedback, you will try to eat more carbohydrate or more fat. That is not good for your heart health. And also, you have to have plenty of sleep. So sleep for 7 to 9 hours. There is no organ or function in the body that is benefited by sleep and that is not uh, damaged by sleep deprivation. Sleep is such an important phase of the human life. So there is no alternative. Sleep is not a luxury. So it is a biological necessity. So sleep for at least 7 to 9 hours in a day. Apart from this, take low carbohydrate food, take small amount of medium amount of protein, minimum fat, medium fat. You take high vitamins, high minerals, high fiber food. Take plenty of water. So you take probiotics. Always take organic foods. So you take variety of foods. So if you are eating fish, eat variety of fish. You are taking pulses, eat variety of pulses. Variety also you have to have. Try to eat the food as unprocessed as possible, and also eat fresh food. Eat food in less frequent intervals, and also go for intermittent fasting. These are very important guidelines for food. So never take any genetically modified food, and also artificial sweeteners or artificial color. Those are not good for health. And coming to food groups, avoid cereals. So and you can take pulses in good amount. You can take plenty of vegetables, both leafy vegetables and also other vegetables. Take seeds, nuts, meat, eggs, spices, condiments, fats and oils, but be careful while taking fats. Only take the fats we have discussed above. And also, coming to exercise and sleep, we have completely discussed about it. Now the final thing is, what is the prognosis? Cardiovascular disease, the final prognosis is death. So it is very important to avoid death, to postpone death until 100 years. You have to be you have to look into this video again and again. You have to understand what is diet, what is exercise, what is actually causing. I have clearly explained about even the fat metabolism or biochemistry of fat. It is very important for you to understand, so that there is a lot of misinformation in the internet. Someone will ask you to take more vegetable fat, someone will ask you to take more animal fat. So if you read and if you go through this video and understand basic mechanism. Now if someone says to take more vegetable fat, you can say them why it should not be taken. If someone asks you to take more animal fat, so you can say why it should not be taken. If someone asks you to more take more fish, then you can say why to take more fish. So different kind of exercises. So when someone asks you to do zone 3 or zone 4 cardiac exercises, you can now say these are not good. So if they say anything about zone 2 cardiovascular exercise, you can readily do it. So see this video again and again and again. This has to go into your blood and bone. If you see something, you should be instinctively, without thinking, you have to say whether it is good or bad for your heart.